We do not treat our patients like patients. We treat them like family. We talk to them, not just how they're doing physically, about their families, about their jobs, hobbies, even their pets. And they like that. And one of the reasons they come back is the atmosphere that we have in OBTS here in Valpo.
It's family oriented to the point where we're close, but we're also close with our patients where we share that kind of information.
It is very lively. You hear people laughing. It might be employees or patients. We talk about everything that they want to talk about. So it's a very fun atmosphere here at Valpo.
Talking with, about sports or movies or The Bachelorette and, it's like day-to-day conversation instead of always about like what they're going through. It just makes it more lighthearted and fun for them.
Most of all, it is our atmosphere, how we make our patients and their families feel when they're here. And that is a big part or a huge part in someone's recovery or rehabilitation.
I tell people all the time that OBTS it's different than a lot of the cookie cutter chain places. They care more, they are more one-on-one, they're more detailed as far as your care and your plans and your treatments. A lot of places don't do like manual therapy, and we do a lot of manual therapy for a lot of our patients. Working on, making sure that we're really focused on the specific problems that they have instead of just everybody kind of coming in here and doing the same thing and everybody's kind of on their own. And we're not about just trying to shuffle them in and shuffle them out and get them through the door. It's more personal.
Several of our clinicians here have certifications or specializations. Haley specializes in pelvic floor therapy. Joe will LSVT or for Parkinson's. Myself, I am orthopedic certified through American Board of Physical Therapy Specialties, and also several of our clinicians here are certified through American Institute of Balance for concussion and vestibular rehab.
When they come in, we just go through all the paperwork with them that they need to make sure that everything's done, insurance information, because we verify benefits before they come in so they know what their responsibility is.
And we have a lot of patients that were convinced that this is their therapy place after talking to our front desk or our receptionist. Once they are good to start insurance-wise, then they will be scheduled for what we call a physical therapy evaluation. We'd like to know about their medications, the history of their injury or their condition, and if they have surgeries or procedures or injuries in the past. We would try to examine the body part or other parts or regions of the body that might be connected or contributing to their problem. Then we will formulate a plan, and then we would be discussing this plan with the patient, and they have to buy in to this plan for this to work. The goal would be to be functional, again, with minimal to no issues regarding either joint pain or dizziness or imbalance. Graduation day can be a happy one. It can also be an emotional one. If we have seen somebody for quite a long time and we have attached or have developed a strong relationship, and of course that last day would be an emotional one. Some of them, they end up crying, and also the therapists, but it's all a happy ending that we were able to help them achieve their goals.
A lot of times they'll bring us in cakes and cookies, and sometimes they'll just randomly bring us lunch, and kind of a little thank you for everything you did for us, and where they don't feel like it was like the therapy was really that hard or strenuous, or that they enjoyed their experience here.
My favorite part is able to diagnose or really pinpointing the root of the problem. That gives me so much joy or delight. With the help of the therapist and the team, we're able to help that patient, and that gives us so much joy or sense of fulfillment. Live an unhindered life with OBTS.